Here is your question. Right. So if you have read and understood considering a critical care scenario, please tell me how would you manage this patient?
Okay, so I will manage the patient according to the advanced trauma life support protocol
Yes.
by ABCD management. So I
Yes.
have to check the patient can able to talk or not. So we have to fix the airway and as well as the cervical spine. Then we have to see the breathing.
Not we, I.
Okay, I will check the breathing. How is the breathing pattern? How is the breathing rate? Any asymmetry is there or not?
Yes.
Any sound is there or not? Then we
Yes.
have to look for circulation. I will open 2 wide bore open cannula and start crystal white fluid.
Yes.
We can start with 250 to 500 ml per 15 minutes.
Yes.
And then we have to check the vitals. How is the blood pressure and pulse, saturation, and how is the mental states? Is there any change? Or patient is unconscious further, and then we have to do maybe I have to do ECG.
Yes.
And we can send those bloods, full blood, and cross match for repair for blood.
All right.
So we have to check the other blood
Considering,
results, which is
thank
already
you.
done.
Okay. Sorry. Thank you. This was correct. And now, considering the condition of the patient, what are the most important conditions?
So my
you will
professional
consider?
diagnosis is rhabdomyolysis
Okay, very
and
good. And
brush injury,
yes, even could be compartment syndrome.
compartment syndrome. Yes.
Could also be there, right? So, how would you manage? Which condition you'll take care of first? If
Okay,
you,
so if it's a compartment syndrome, we
yes,
have to take care of this one first. So we have to check the sign and symptom. Is
yes.
there any pain out of
Patient,
proportion?
patient cannot tell you because has become unconscious. So, what
Yes.
would you see?
So,
How many
so I have
compartments
to.
are there in the leg?
So in
Leg.
the leg we have 4 compartments.
Very good.
Two posterior
So you'll do the
subarachnoid.
fasciotomy through which compartment?
Yes, ma'am. So I have to check the sign.
Yes.
Is there
Yes.
any like calm, coldness, and then pulselessness,
Yes.
and then maybe any color changes? Then, if there is possibility, we can check the compartment pressure. If
Yes.
it's more than 25 to 30 millimeter of mercury,
Yes.
then we have to open the. We have to do fasciotomy.
Which
So
is
we
an
have to
emergency
open.
procedure. Okay,
Yes.
can you define the term rhabdomyolysis?
So rhabdomyolysis is the breakdown of skeletal muscle cell due to any trauma or any
Right.
long-term
Good.
crash.
Other than road traffic accident or trauma, what else can cause rhabdomyolysis? Can you give any other causes?
Other than road traffic accident, it can be severe burn. It can be
So
secondary to assault.
Okay. Yes, and fracture.
Secondary to assault, fracture, long bone fracture.
Yes, very good. And
compartment syndrome.
And there could be hypothermia or hyperthermia.
Hyperthermia.
Yeah. And even acute ischemia with reperfusion injuries. That can
Yes,
also be.
reperfusion injury.
Very good. All right. Patient, as you could see, the labs is showing urea and creatinine are high, and their electrolyte potassium hyperkalemia. How would you take care of that? And even the dripstick is showing blood. So clearly you can see the acute kidney injuries there. How would you
Yes.
take care of that?
So I can see the picture of acute kidney injury,
Very good.
secondary to rhabdomyolysis.
Yes.
So we have to start a vigorous fluid challenge. We have to start 1 liter normal saline running, and then I have to insert the urinary catheter to
Good.
monitor the urine output,
Yes.
and I can check the blood pressure and pulse and capillary refill as well. So we have to I have to do an ABG to check how is the pH and
Yes.
lactate,
Yes. And
and
for
then maybe I
hyperkalemia?
can. So for hyperkalemia, we can start shifting. We can start 10%, 10 millimole of calcium gluconate over 10 minutes.
Good.
I can give insulin, 10 millimole of insulin in the 50% dextrose. I can start salbutamol nebulization, and at the end I can give sodium bicarb.
Good. In order to
And then
yes.
maybe we can admit the patient to ITU, and we
Yes.
can think about dialysis if the renal function is deteriorated.
Deteriorates or is non-responsive to your management. Okay, considering okay, if you have to consider to rule out compartment syndrome, what are the 5 P's that you'll consider?
So is the pain out of proportion, poikilothermia,
Yes.
pulselessness, pallor,
Yes. And paresthesia and
paresthesia.
and 2 more.
2 more. Pain out of proportion,
Yes.
poikilothermia, paresthesia, pallor, pulselessness, and one
Okay,
more.
good. All right. Can you tell me if you know the definition of myoglobin? Because
So
yes,
myoglobin is a protein which is came to the bloodstream due to rhabdomyolysis.
yes,
So hemoglobin in hemoglobin, oxygen is replaced by carbon monoxide.
okay,
So that one is toxic for kidney,
yes,
which can go to the renal tubule and block the renal tubule and cause acute tubular necrosis.
okay, good. Right. What more you can tell me about? Right. Mm. Okay. In this condition, if you take ABGs, arterial blood gases, what do you expect to see?
So I'm expecting here is metabolic acidosis
Yes.
due to hyperkalemia
And
and maybe lactate acidosis as well.
acidosis, yes. And because of what type of shock is patient undergoing?
So patient might have hypovolemic shock, patient might have neurogenic shock due to
Yes.
pain,
Okay. And
or even could be cardiac shock due to hyperkalemia.
right. Okay. Right. How would you categorize the shock? At what category of the shock is patient going through right now?
Okay, so for hypovolemic shock, though here there is no
Patient is unconscious, so you know the level.
yes. So for unconsciousness, it can be stage 4.
Yes.
There is no other parameter is mentioned here.
Excuse me, crushed legs. So if leg is crushed, how much blood is being lost, or what is the level?
Yeah, for a long bone fracture or cast, maybe more than 1.5 liter.
Yeah. So
So that
again,
one is
3
also
to 4.
stress 3 to 4. Yes,
3 to 4, exactly. So yes,
yeah.
criteria has been given. So it's just that you have to pick it. Good.
Yes, ma'am.
Good. Very good. Okay. Thank you.